Hi everyone, Marijuana Mom here. How are y'all doing this fine day? Christmas is over, New Year's is approaching. Hope everyone had a wonderful holiday. Today we're going to talk about pediatrics and cannabis. I haven't had the opportunity let me take my glasses off. I haven't had the opportunity to give this a try. However, I have seen others using this as a medicine, cannabis, mostly higher in CBD than in THC. So I've seen it used in epilepsy, cancer. I've seen it remove cancer tumors out in Colorado. Autism spectrum disorders that do not respond to conventional treatments. Their option is medical marijuana. Any consideration of cannabis as a medicine for infants and children must be approached with special caution and be informed. Make sure you're informed as a parent. Professional medicine oversight, because consistent interaction with the receptors. Cannabis has a consistent interaction with the receptors that regulate physical development and varieties of the function throughout the body. It is still listed as a Schedule 1 drug, up there with heroin. God knows why. There again, our government. Medical marijuana and heroin are two different drugs, but they are listed as the same, which we as Americans have to change because the government's too smart. Our government controls the studies of the use of cannabis medicine. So we follow others. There is one man in Israel who's doing a study, and really, I want you to look him up if you are interested in trying cannabis on your child, your infant. His name is Raphael Mechoulam. It's Mechoulen, and Raphael is Raphael. He's studying brain injuries, osteoporosis, and if you want, you can look him up on YouTube. He's got a lot of stuff on there right now to help you guys. He believes in the medicine, just like we have a doctor here in Pennsylvania that believes. Now, parents investigated the use of alternative treatments, included cannabis. Raphael is the Israel medical chemist who first did the structure. He found the structure of THC in 1964. He's the one that isolated THC. And in 1990, they found CBD. See, they don't study the plant enough to find out what it can and can't do. They left that up to us, professional parents. I've looked at Raphael's YouTube channels. Man is very smart. Man is very, very smart, and he's ahead of his time. Here's some of what he studied. He understudied small cannabis trials he conducted in 1990 under the supervision of pediatric oncologists at an Israel hospital. Do you know how he used to buy his THC, his weed? He used to go to the jail and steal it. Well, he used to buy it from the prison inmates, the guards. And the guards used to sell it to him. Then he went there and they said, this is illegal. So then he had to buy it on the street to do his test. Is that messed up or what? Come on, people. On 8 children at the age of 10 undergoing chemotherapy for blood cancers. He found that it removed many of the suffering children's horrible nausea, vomiting they endured during and after the chemo treatments. He and the oncologist designed a protocol to test delta H THC as an anometric. Delta H is the most stable isomer on THC and it's unlike delta 9 that does not oxidize into cannabinoid. Delta 9 is the one that gives you a head high. Okay, so his study showed that you're going to want to read. During the trial of 3.5 years, showed irritability, but only for the first 2 doses. All the children stopped vomiting for the duration of the trial. He was elected to publish the results, but they never received a single inquiry about it. The use of THC in children, even with the result, was a non-starter for the gynecologists and the hospitals. So basically it sat. Nobody would investigate it. The best collected, reliable survey in 2013 is the researchers at Stanford University. They're doing preliminary studies on the CBDs. Pediatric epilepsy patients in California. Miss Dr. Elizabeth Ann Thiel, professor of neurology of Harvard Medical School, director of pediatric epilepsy service in Massachusetts General, gave her testimony. And her testimony is based on review of the literature, firsthand experience with pediatric epilepsy patients. In my opinion, that medical marijuana is particularly the non-psychoactive ingredient in medical marijuana, which is CBD, may have substantial medical benefits for pediatric epilepsy patients, as well as significant fewer adverse side effects than many other anti-epileptic therapies available today. According to her, in this book, she has documented that, yes, it does work, and I've seen it work on many others. The reason that we are lacking evidence is because the government won't let us document. Documentation is proof, and God forbid we have any proof. They don't want you to have proof that it does work. So, I mean, excuse me, for us, we found a doctor, I don't want to give his name because then he's going to be like, oh, but we found a doctor in our area that is really starting to study cannabis as a medicine. And he's using my daughter to test it. And I'm letting him because she wants to. She's 21 years old. Well, she's 22 years old. Even if I didn't want to, I couldn't stop her. And I see significant change. She walks without so much of a limp. She walks like throwing her body around, and it tears up her whole body. It's not like, hey, not like we walk on a normal. She has a real hard gait when she walks, and her gait is, it throws her around like this because of the limp. And that's due to the surgery that the doctor said we had to have. We never got the chance to try medical marijuana when she was younger. Medical marijuana has been shown to reduce spasticity in the body's muscle. And that's proven in Colorado. I've seen it on my daughter. So, seeing is believing. And anybody out there that wants to give it a try, and if you have any questions, don't hesitate. I'll see what I can find out. Because I'm starting to really regulate who I speak to, and I'm getting to know some of the physicians that really believe in this medicine. And I believe, or I wouldn't be here telling you, because a lot of people see it as a drug and they're still stuck on stupid. They don't realize they could be helping their child instead of stigmatizing medical and recreational. Recreational is a whole new world. That's for people that want to get stoned. They want the head high. They want to relax. Marijuana just makes you relax, no matter what. Unless you're doing a CBD, you don't really feel anything. Your body feels this adjustment. Like, oh my God, my daughter says this right from the horse's mouth. Britt, how does it make you feel? Mom, I feel normal. And I'm like, for the first time in her life, she feels normal. Even in that twisted body. It's not really twisted, but it's twisted when she walks. Now, if I would have had the opportunity to try this when she was younger, let me tell you what. Who knows what could have changed? She has cerebral palsy. It's not even written in the books. They're saying you can use spasticity. Sure, I can, but spasticity is in a lot of different things. I want to isolate cerebral palsy into this medical marijuana because I can help so many people that don't think there's help. There's help in the dumbest things you would not expect. Listen, my daughter had a headache yesterday. You know what she said? She works for, I'm not doing any advertisement, for the Mission on Emmaus Avenue in our local town. That's a pharmaceutical marijuana medical location. She works there, and they tell her patients that she talks to tell her, Mom, they said this works on headaches. I'm like, well, so she rubs some lotion on her head and under her eyes here. She said within 3 minutes, the headache was gone. 3 minutes. Ibuprofen don't even work that fast. Tylenol doesn't work that fast. In fact, I don't know anything that works that fast. So the next time I get a headache, I'm going to give that a try, and I'll let you know how that works. I do know that the lotion or cream, whatever you want to call it, I put on a couple lumps I had here, and they're just about gone. And those are cysts, benign cysts. Is that you, Bowie? No, that's Clyde. That's my bird, Clyde, yapping away. It's okay, buddy. Excuse my birds. Well, I guess I'll sum this up. If you're going to try this on your infant child, speak with a doctor. See what he says you should try. Make sure he's a cannabis doctor. Make sure he's somebody with some knowledge. And you can even go to your pharmacy. I don't know how comfortable people feel about treating children, but hey, if you've tried everything out there on the market that the government's given you, what the hell's it going to hurt if you try medical marijuana? I mean, Clyde, your tail is in my camera. Thank you, bro. That's my baby. My birds are Bonnie and Clyde. It's a long story. I'll tell you about it sometime. No. They are criminals of the highest kind. Right, Clyde? Anyway, everyone have a wonderful day. That's the end of this series. This is on the pediatric cannabis. Oils, I suggest. Lotions, for sure. A lotion can't hurt anybody. If your baby is all tensed up at CP, I mean, my baby don't have the tight muscles, but I've seen kids that can literally, whoa, with lotion. Do it. Try the lotion if you don't feel comfortable with anything else. The oil is mostly what they give the child, the infant child, because they don't smoke. There are other avenues to get this into your body. You don't have to ingest it. You can. Oh, there's lotions, there's tinctures, there's pills, for God's sake. And like I said before, you can't overdose on medical marijuana. So what you'll want to do if you did take too much is lay down and sleep it off. Don't cry the blues. It's just a high. All you're going to do is come down and you're going to say to yourself, let me try that again, not so much this time. And believe me, that might be the key to most of your problems. I have fibromyalgia and I use it. I use the lotion a lot. I cannot believe how that stuff works. All right, everyone. Thanks for watching. If you like this, subscribe and hit the bell so you can get a ding-a-ling. Everyone have a great day and happy holidays. And 2019 is going to roll in. I hope you're all ready. I am.